coming to the next question, I would call it as a myth buster. So people always say that there is no patient connection in your field, because many a times patient don't primarily come to you, or there is no direct connection between an anesthesiologist and patient. What is your take on that?
Uh, there is partly truth and it is partly false. As if you say that the initial interaction with the patient is there or not, no, it is not there. Initially, the patient only knows the surgeon. Surgeon diagnose the disease, or the physician diagnose a disease and then refers to the surgeon who is going to do the surgery. So patient, at the initial level, patient interacts with the physician or the surgeon. And the surgeon, yes, it is right that a surgeon is the person who brings the patient to the OT. However, now the true part is that when we do the pre-anesthesia checkup, okay, so many of the means that is the time when we got the opportunity to interact with the patient, and that is the time when we can make the the most impact as an anesthesiologist onto the patient. So that's the time when in my PG days I used to communicate a lot with the patient. I used to ask कि क्या आपको और कुछ पूछना है, whether you want to ask anything more or not, what the surgeon was not able to tell you. So patient asked so many things, कि sir, how the surgery will happen, what are the precautions we use which we have to take after the surgery, before the surgery, I had a diabetes or hypertension, will this hamper my surgical outcome, or how many days will I take to recover from the surgery. So I used to talk a lot with the patient, because I like the patient interaction from a day one. So only the pre-anesthesia part is the part when we had a interaction with the patient. Apart from that, I don't think so we have an interaction with the patient. Just before the intubation or just before the induction, again we interact with the patient. We make the patient cool and calm. We just assure them that everything will be fine. You will be fine. You are in a good hands. I will take care of you. I am a Dr. Anshul Taran. I will take care of you. You don't have any pain during the surgery. After the surgery, I will take care of you. So so that only this is the part where we interact with the patient. Apart from this, no, we don't interact with the patient.
Now tell me, what are the super specialty branches, or what are the like different opportunities once you complete your post graduation?
This is the good question which I was asking from you, because I'm doing one of the sub-specialty or super specialty of pain. Maybe you people who are watching this video must have guessed that I am my mother branch is anesthesia, but I may not be practicing anesthesiology. See, there are so many branches which you can pursue after completion of anesthesia. One of the famous branches are ICU. You can be an intensivist after doing anesthesia. You can do post graduation or in cardiac anesthesia. You can opt for pediatric anesthesia. You can opt for transplant anesthesia. Okay. So there are so many things which you can pursue after anesthesia. And one of the new branch which is emerging in last 10-15 years in our country, India, and that is the pain management, or that is a pain physician.
Please tell us more about the pain management and like what you are doing in your practical life.
Sure. I will say a lot about this thing. Yes.
Yeah, we would love to hear that.
I think you have to make another video on that pain management.
Yeah.
Okay. So one of the newest branch in after anesthesia is a pain management, or as a pain physician. So finally, I am the consultant pain physician. I am a full-time pain physician. I don't practice anesthesiology per se. And not because I don't love anesthesia, because I love pain management branch. In the pain management is a part is a part of anesthesia, where we just acting as a physician. We see so many different pain syndromes or the pain diseases, or the diseases which is accompanying pain. And the most important part is low back pain, shoulder pain, knee pain, neck pain, low back pain with radiculopathy. Radiculopathy means when the pain is radiating from the low back to the leg, from the one of the leg, or from the neck pain to the hand, along with tingling and numbness, which in the normal terms we say sciatica or the slip disc. Then we used to treat so many myofascial pain, which involves pain, muscle generated pain. And then there are so many different terminology, like slip disc or facet joint arthropathy, okay, or CRPS, or post-herpetic neuralgia, or trigeminal neuralgia, headache. So there are so many things which we deal as a pain physician. And we have two things in that. First is a conservative treatment, and the next is a minimally invasive treatment. In the conservative treatment, just like any other physician, we give the medicines, and if the person does not get relief from the medicine, then we go on to the interventions. For example, the genicular nerve block for the knee pain, the transforaminal block for the radiculopathy, low back pain, radiculopathy. So there are so many things. And I would like to request to Dr. Arif that make another video on that, so that I can, I can talk on and on and on pain management, because this is a branch which I like so much. That's why I am pursuing pain from my initial days only.
Yeah, definitely. I'll make another video, and we will talk about only pain management as as a field, so
Yeah.
that those who are aspiring to become pain physicians, they can also come to know about the benefits, the challenges, and everything. Another question I would like to ask you, mm, like so many girls, they are very hesitant. Sometimes they have some doubts about the field. So I would like to ask, is there any difference between male anesthesiologist or female anesthesiologist, or like, or in a simple way, I want to ask whether it is a female friendly branch or not.
I think it is one of the branch which is very much female friendly. Because as I've said, the anesthesia is just like a medicine branch. It is just like a medicine. That's why the full name of anesthesia is the perioperative medicine. It's a
Yeah,
perioperative medicine. Okay, so it's a medicine which we use in a perioperative settings, before, during, and after the surgery, after the operation. So there's no difference in there. Females are as qualified as the males. Females do all those procedures which the male do. Even if you will be surprised that in the medical colleges, what I have seen till now, there are almost equal or better ratio of female consultants as compared to the male consultant.
that's good. Now the last question. What message you would like to give to the PG aspirants who are willing to take anesthesiology as a, they want to opt as a career?
Okay. See, I know that there are so many residents who come to anesthesia by chance, and they not by the choice. Uh, See, there are always a practical things which are related to this. Many people does not want anesthesia, but their rank forces them to be an anesthesiologist. So see, the only message which I will give to you people, that anesthesia is a very good branch. Uh, it is a branch which gives you recognition, maybe not among the patient, but among the physicians, among the surgeons, among the physicians. It's a branch which can make your life very good. You can live a good life because you will earn a handsome amount of money. This is a statement I am purposely saying, because so many because many of us medicals, obviously they wants to make their life good. This is a branch which makes your quality of life good. uh, this is a branch which can give you a ample amount of time to spend with your family. It's a branch which can make you satisfied if you want to be. Why I'm saying like this? Because as I've said earlier, one of the cons of this branch is that it is somewhat dependable. You have to rush to the hospital as per the surgeon's time many a times, because surgeons are not the good person for the anesthesiologist. So
But what we feel that we have to wait for you, because most of the time it happens because you are so busy at many places. So we also wait for you. That is
okay,
also true.
I'm not. I don't want to go into that on this live video. Okay,
Yeah, yeah.
so
But do tell us about the work-life balance. What about that in your
see,
field?
this is the simple answer of this type of question for any branch, be it a surgery, anesthesiologist, medicine, peds, and whatsoever. The work-life balance depends upon you. The work-life balance does not depend upon a branch. If you don't want to work after 6, 7, or 8 p.m., then don't work for it. Don't work. If you want to work till 12 a.m. in the night, from the 6 a.m. in the morning, then you will work. So work-life balance depends upon you. If you don't want to do cases, if you are an anesthesiologist, and if you don't want to do cases after 7 p.m. or 8 p.m., then you can choose that. Surgeon will identify which anesthesiologist will be available after that or not. If you are a good anesthesiologist, surgeon will always prefer you. If you're a good anesthesiologist and you just say to your surgeon that I want to work, I am available between 9 a.m. in the morning till 7 p.m. in the evening, then he will call you in that time only. And after 7 p.m. he will call you another anesthesiologist. So it depends upon you. You can make a work-life balance as per you. So it's a personal choice, sir. I think
So
you can.
it was
I'm enjoying this conversation so much that you can ask me n number of questions, and I am ready for that.
even I am enjoying it, but I would like to tell you it's already 1:15 a.m. So we are recording it in the midnight, literally in the midnight, after completing our OTs and all our work. So
That's
it can give everyone a clue that how our life is, because even to have such a pleasant or कुछ अच्छा आराम से कुछ काम करने के लिए we have only this time. So
so.
that
This
is
is,
also like one good part of our life.
now this is a time when I'm having an adrenaline rush, because I'm able to communicate with you on this subject. You become a
Yeah.
surgeon, I become an anesthesiologist, the two friends. So the life is better with the friends, even at 1:15 a.m. in the midnight. Acha, Arif, I just want to add two things. I have written
Sure, sure,
specifically for this
sure,
particular
sure.
interview, that uh, uh, for the residents who are going to take anesthesia, they may ask that, I think as a surgeon you should ask that, as an anesthesiologist, what difference will we make to your patients while doing the surgery or after the surgery. So uh, as an anesthesiologist, your patient may not know you, but you make a lot of difference to the patient's recovery. See, this is a practical point that the surgeon does not, think so much about this point, but as an anesthesiologist, you think so much. We have one concept of ERAS, ERAS, ERAS protocol, that is enhanced recovery after surgery. So what does this protocol say? That we want to make the patient mobile as soon as possible. We want to make patient mobility easily so that he or she can go home as early as possible. How we make that? We make that recovery by decreasing your pain as low as possible. You know, by by managing your medications after recovery, after the post-operative things, and we focus on your nutrition. We focus on your fluid balance. is you are fluid deficit or not. So we focus on all those things so that the patient recover fast after the surgery, so that he or she can go home, because this recovery makes a huge impact onto the patient's physical profile. Okay, so as an anesthesiologist, it's our responsibility to make that. It's not a surgeon's responsibility. However, nowadays more and more surgeons, they also help us to do this ERAS, to help in our ERAS protocol and our recovery after surgery, because ultimately it's the surgeons who will get all the credit for this early recovery, not us. Okay, then the
Yeah,
second thing.
that's what I want to say. We also recognize that you are very helpful for the recovery of the patient, because it is said that behind every successful man there is a woman. But in our surgical field, we say that behind every successful surgeon there is an anesthetist. So we do recognize your work and your contribution for the recovery of the patient.
I think you
So
are.
you are
I
about
think
to.
I think you are saying this sentence only for the sake of video.
No, no, no. Actually, once I'm outside the OT, then I'm a common person. But once I'm in the OT, at that time we will have that our quarrel between, tussle between surgeon and
Yeah,
anesthesiologist.
yeah. Acha,
Yeah.
one more thing. The last
Yeah.
point I
Second point
want to
you
add.
wanted to add.
Yeah.
Yeah.
So many residents may think before taking anesthesiology that what you do inside the OT, you just not only did just you behosh the patient, you just make the patient unconscious and left the OT. What the normal layman says in, I'm just saying in Hindi, आप तो बेहोशी वाले डॉक्टर हो ना, बेहोश करके आप बस बेहोश करते हो और आपका और कुछ काम नहीं है. I'm just translating in English that so many layman people just say you are just the unconscious man. You just make the patient unconscious and just leave. Okay, this is what the anesthesia is. So I don't want to answer. I don't want to give answer to the layman. For the residents who wants to take the, for the UG people who wants to take the anesthesia, what you basically do before the OT, within during the OT and after the OT. Before the OT, you just examine the patient. You examine is there any comorbidity like blood pressure, sugar, thyroid is there or not. A patient is suffering from these diseases or not. If patient is suffering from these diseases, is all these diseases are under control or not. If this is if this is under control, then it's good. If it is not under control, then you refer the patient to the medicine guy, and he or she will control that thing before the surgery, and then the surgery will happen. Then before the surgery, apart from the diseases, you just check every organ status like cardiac status, your renal status, kidney status, liver status, and any other thing. You just check that is any infection or not in the body, if the patient is suffering from fever or not. So you all check all these things and then make necessary adjustments. Then if a patient is after doing all the corrections in the normal physiology, then the patient is posted for the OT. Now inside the OT, as an anesthesiologist, what you do? First of all, if it is under GA, general anesthesia, you make the patient unconscious. You take control of all the vital monitor of all the vitals like heart rate, blood pressure, respiratory rate, okay, everything, blood pressure. At the same time, you take control of the pain. You don't want to make the patient suffers from pain, because even in the unconscious state, if a patient is suffering from pain, we can make an idea how, after seeing if there's a tachycardia, increase in pulse rate, it means the patient may be suffering from pain. So you give all the analgesics accordingly. That then you replace the fluid deficit. Is there any, because the patient was nil by mouth since 8 to 12 hours from the midnight. And then at the end of surgery, you extubate the patient, take out the tube from the patient, make the patient comfortable, make him or her free from the pain. And then the patient becomes conscious, then you transfer the patient to the ward, and then slowly you help in his or her recovery. So this is what in summary the anesthesiologists do. And I just give you summary that it's a very good branch. If you are not interested in surgical branch, if you do not interested in other branches, even if by chance you enter into this anesthesiology, overall it's a good branch. there are some positives, there are some negatives, but I think it will give you a very good life and a good satisfaction in your life. And I think if you are getting it either by choice or by chance, do grab this branch. It's a very good branch, and I think you will be satisfied.
Thank you, Anshul. Thank you very much for your time and explaining everything in such a simple and sweet language.
Thank you, Arif. Thank you so much.